Disclaimer, all views, thoughts, and ideas expressed on this podcast may or may not represent the opinions, thoughts, and views of St. Louis Story Stitchers. Stop and take a trip down on my block where you see hidden potential, young minds sharper than pencil, and ain't afraid to speak their mind if they got something against you. We standing with you, we tackle issues like civic pride. Hate will cease to exist, let's put our differences aside. From my side to your side, from Dutchtown to Southside, from Penrose to North Side, from Benton Park to Old North, the West End, the West Side. We blessed when we step out. We stand down, rise up, stand together, wise up.
This is StitchCast Studio, produced by St. Louis Story Stitchers in St. Louis, Missouri.
Season 3, episode 56, titled COVID Vaccine, Fear and Facts. As the new Delta strand sweeps into the St. Louis region, youth leaders alongside Dr. Frederick Echols discuss the fears and facts of the COVID vaccine and the new mask mandate. They say who that, but you already knew that. That be them story stitches, story stitches, story stitches, story stitches, story stitches.
Everybody, welcome to another episode of StitchCast Studio. Today we are going to be talking about COVID fears and facts, part 3, I believe. This is part 3. And today we have here with us a very special guest, Dr. Echols. Dr. Echols, if you don't mind, could you just kind of introduce yourself to, maybe listeners who will listen to this later who may not know who you are?
Sure, my name is Dr. Frederick Echols. I'm the Acting Director of Health for the City of St. Louis. Some of my background includes having medical training at Boston University School of Medicine, served time in the military, as well as served as the Director of Communicable Disease for the state of Illinois, and the Director of Communicable Disease Control Services, Vector and Veterinary Programs, and Emergency Preparedness and Response for St. Louis County, prior to taking on the role of Director of Health for the City of St. Louis.
Okay. Cool. But like we said, today we're going to talk about more fears and facts about COVID, the vaccine. And first, I kind of want to just get some stereotypes out the way. Like, I like doing that, just to kind of clear the air, So one of the, or I don't know if you call it a stereotype, but one of the things that I hear a lot that some people are afraid of is that, excuse me, if they get the vaccine, will it make them sick? So could you talk to us a little bit about that and even kind of like where that stemmed from? Because I know maybe with like previous vaccines that might have been something that was the case, but could you kind of talk to us about that a little bit?
Absolutely. So side effects of vaccines vary from vaccine to vaccine, but one common theme that we typically see is that there are some symptoms that individuals will develop after receiving a vaccine. Most commonly, individuals will have pain at the site of injection where the vaccine was placed. Some individuals will have symptoms such as fever, headache, chills. For example, with the flu vaccine, oftentimes individuals will have flu-like symptoms after receiving the flu vaccine. And that's really important because it shows that the immune system is working, but they don't actually have the disease process. So the vaccines, when they're developed, they just take bits and pieces of the proteins to create the vaccine, and so your body is able to recognize components of the virus or the bacteria in the event that you're infected. But when you receive the vaccine, they aren't actually giving you the disease. They're just helping your immune system, prepping your immune system to respond in the event that you do become exposed and infected with a virus or other pathogen.
Okay, cool. Really quick, too, something that just came up when you said that. I don't know why, but I think it was last week we had a dance battle, and I think it was some of our partners from Wash U was hosting like a survey, and I think one of them talked about how there's like an actual database that's being recorded for people who get the vaccine. Can you kind of talk to us a little bit about that? If you know anything, like what are they tracking and like how does that work? And if they share that information with the masses?
It's the one database that's used, or one platform that is used. It's called VSafe. It's V and then SAFE. This is a platform that's used for all vaccines that are made available to the general public, particularly vaccines that have been approved by the FDA, either official approval or through emergency use authorization, like we have for the COVID-19 vaccines that are available. So the purpose for VSafe is to make sure that any side effects that individuals experience after receiving a vaccine product is reported to the federal government. And this allows them to track symptom profiles for each vaccine product. Then if there's any worrisome trends that are detected, they can pull products from the market to do an investigation. That's actually what happened with the Johnson & Johnson vaccine. So remember when there were reports of individuals developing blood clots, and then there were a few deaths associated with that. They pulled the vaccine product because that information, those complications, were reported to the federal government. If we didn't have those checks and balances in place, it could be years before we identify complications associated with particular medications or other pharmaceutical interventions that are approved for the general public.
Okay, cool. Did you have anything yet? And while he gets his question too, do you know why, or has it been, what is the requirement for the vaccine? Is there any type of requirement that people have to have in order to go get vaccinated? Any type forms of identification or anything like that?
And so right now the COVID-19 vaccines are available for individuals age 12 and up, particularly. So the Pfizer vaccine is available for individuals who are 12 years of age and older. The Moderna vaccine is available for individuals who are 18 years and older, and the Johnson & Johnson COVID-19 vaccine is available for individuals who are 18 years and older. Typically, when individuals come to a vaccination clinic, we do ask for some form of ID, and that's really it, a form of ID so we can verify that you are who you are. We don't ask for insurance information or other information because we aren't charging your insurance company for this service. So only just a government-issued ID or standard ID is sufficient.
Okay, cool. That's good to know. And what about for COVID testing as well?
Same for COVID testing. One advantage of having an ID on site, on hand with you, is that sometimes individuals' penmanship isn't greatest. So, for example, my penmanship can be very, very difficult to read. And so having a form of ID on hand with me, if I need someone else to transcribe my information, they can do so and do it accurately. And that's really important for the Moderna vaccine and the Pfizer vaccine, because we need to have accurate contact information for individuals so we can contact them and let them know when they're due for their second dose. If we don't have contact information or accurate contact information, or the information is not legible, then that can create issues for us being able to contact individuals in a timely manner. And we want to make sure that we aren't creating additional barriers for individuals to complete the vaccination process. We know in the city of St. Louis and other parts of the state of Missouri, the vaccination uptake isn't as high as we want it to be. And so making sure we're able to contact individuals in a timely manner to get them in for their second dose is really important. And that's also important because we want to make sure that we're complying with the regimen that has been prescribed, that has been approved by the FDA. So through the clinical trials, there was a certain regimen that was tested, and that's what the FDA approved. So making sure that individuals who receive the Pfizer vaccine return in 3 weeks is really important, and making sure individuals who receive the Moderna vaccine return in 4 weeks for their second dose is really important.
That's good to know too. I didn't know it was that far apart either. I thought it was only 2 weeks maybe at max. Cool. Thank you so much.
My question was, what is the pros and cons of the vaccine?
So everyone is a little different, so I can talk about my personal experience. So the pro for me was really being able to conduct an action that shows that I'm compassionate about my community. Oftentimes when we think about doing things, it's all about what do I personally gain from it. But when we look at the impact that COVID-19 has had on communities across the city of St. Louis and across the state of Missouri and across the world. One simple thing that we all could do to show compassion for other individuals is to get vaccinated. And so that was really important for me. And one of the downsides is, sometimes you do have you get a few symptoms. My only symptom really was a pain at the site of injection. So I had a little arm pain for like 24 hours, and otherwise that was it. I had no fever, no chill, but everyone responds to the vaccine differently. But for me, it was really about understanding the importance of getting vaccinated for individuals beyond myself, so for the community at large. We know that in some communities, particularly African-American communities, there has been a lower uptake than we expected. But when we look at which populations are being impacted the most, African-Americans are right now accounting for about 80% of all COVID-19 cases. And it's not just older adults, it's younger adults as well. And oftentimes as a younger individual, we just consider ourselves, but think of the fact that, you getting infected could lead to other members of your family getting infected, because when you're at home, are you really wearing a face covering all the time? If you have your nephew or niece or another young person in your family, are you always wearing a face covering and socially distancing from them?
Right.
Oftentimes we want to hold the little ones because those are our because babies are cute, right? You just want to hold babies. They're cute, and you just want to love on them. But in this case, if you're infected with COVID-19 and you're loving on them, you could actually be causing harm to them. And so doing our very best to protect those who aren't able to protect themselves is really critical.
Okay. I like that. Thank you for sharing. Another thing I kind of want to touch on, because lately we've been hearing a lot about variants. So really quick, because I'm going to get deeper into that, but really quick, could you explain to us what is a variant for people that may not know?
Yeah, so in simple terms, so for a viruses they can change their genetic makeup. So they can, when the conditions are right, they can change their genetic makeup, which would lead to them becoming more virulent or more toxic, or give them the ability to spread more efficiently. And so what we've seen over the course of the pandemic is that as newer variants are detected, they spread more efficiently and they are more virulent, meaning that they're more likely to cause severe complications requiring hospitalization, in some cases death. And so it's really important for us to not just focus on a particular variant, but we really need to focus on stopping transmission. So stopping the spread of SARS-CoV-2, stopping the spread of the virus. And so often when the vaccines came on the scene, a lot of people thought of vaccines as being the silver bullet, like I can get vaccinated and I'm good to go. But the virus is still circulating in our community, and similar to how we approach the influenza virus, even after you get vaccinated, you still need to implement those mitigation measures because the virus is still in our environment. And even though you're vaccinated, you can still get infected and you can still spread it to others. There's a recent study that was done by the CDC on an outbreak that was done that was detected in Cape Cod, Massachusetts. And what they found was that there's over 450 individuals who developed COVID-19 disease. And I think that's something we need to specify too. So SARS-CoV-2 is the virus, then COVID-19 is the disease process or the symptom constellation of symptoms that develop as a result of your infection. So in Cape Cod, there was over 450 individuals who developed COVID-19 disease because they were infected with SARS-CoV-2. And what they found was over 75% of them were vaccinated. So that provided evidence that even though you're vaccinated, you can still spread the virus to others. And so I know we were really rushing to get back to normal, but we really have to realize that we're still in the middle of a pandemic. We don't fully understand how this virus behaves. And so we have to do our very best to not only protect ourselves as adults, but we have to make sure that we are able to implement actions that protect those who aren't able to protect themselves. So For example, youth under the age of 12 aren't eligible to receive a COVID-19 vaccine. We have infants and toddlers who are just living life, and they really don't understand what's going on at this point in time.
Right.
So us as adults, young adults, older adults, we all have to do our due diligence to protect those who aren't able to protect themselves. And one of the ways that we can do that, wearing a face covering, socially distancing ourselves, particularly from those who don't live in our household, and making sure we practice good hand hygiene, washing our hands regularly, using soap and using hand sanitizer when soap and water aren't available, are key things that we can do, along with getting vaccinated.
That's good you said that, because that was actually one of my questions. Like, never mind, you already answered it though. What was I going to ask next? Okay, yeah. So we were talking about variants. So two of the biggest ones that I've heard about personally, I think, is the Alpha and the Delta.
Delta,
yeah. So what is the difference? And is there one that's more deadly? And how do you know? Is there anything yet that lets us know the difference between the two or the three? Because we have the regular one, the Alpha and the Delta, right?
Well, actually, there are 6 that we're monitoring in the United States.
Wow.
But outside of, there are 6. And that's just in the United States that we're monitoring. But there are additional variants that are circulating out in other countries. For example, in South America, the Lambda variant is circulating. It's causing the result of over 80% of the cases in Peru. And so that variant can easily be introduced into the United States because of international travel, right? So it's only a flight away. And so we have to be mindful of not only what's happening in the United States, but what's happening in other parts of the world because of international travel and other worldwide activities that we participate in.
Yeah. So also, is there any way for, I guess maybe as just regular everyday people who don't study these things, we probably wouldn't know if there's a difference. Like, say somebody is sick with COVID and they have the Delta, and then somebody else is sick and they have the Alpha. Is there any way to, like, at least for you all as doctors and physicians, is there any way for you to know? And another question, I guess, on top of that would be, does the vaccine help with either of those, like, with the new variants that we have?
And so the only way to officially determine if someone is affected with a particular variant is through genetic sequencing. So the virus has to be genetically sequenced, and that's typically done by the CDC or a vendor that the CDC selects to provide laboratory services. So if I'm infected and I'm coughing and so forth, you as an individual, you won't know if I'm infected with the Alpha variant, the Lambda variant, the Delta variant, or some other strain that we don't even know about yet. And so that's why really protecting ourselves is really important, because the Alpha variant is the first variant that was detected. So that was the one that was circulating in the United Kingdom or the UK, and was causing the majority of cases in the UK. The Delta variant is a later strain that came on that was discovered, and what we found is the Delta variant, when compared to the Alpha variant, it spreads more efficiently, and it's more virulent, meaning that it's more likely to result in an individual being hospitalized or even or resulting in death.
You said the Delta, right?
The Delta.
Okay.
And it's important because that's been what's been in the news lately, particularly in the state of Missouri. And because in the state of Missouri, the Delta variant is now accounting for about 90% of all COVID-19 cases. So if you've been listening to what's happening in southwestern Missouri and north central Missouri, those jurisdictions are being overwhelmed because the Delta variant is spreading rapidly, and particularly amongst unvaccinated individuals. And so the hospitals are overwhelmed. They're in the need. They need additional medical support, and so the doctors, the medical teams are really overwhelmed because the hospital beds are being occupied by COVID-19 patients. And that's something that is really important as well. So when we look at when COVID-19 patients come into the hospitals, that reduces the number of beds that are available for individuals who have other chronic illnesses and other emergent medical conditions. So someone, for example, if someone has a stroke or someone has a heart attack, if they're going to a hospital where all the ICU beds are filled, all the cardiac beds are filled for people who are infected with COVID and experience COVID complications, then that puts them at greater risk for dying as well.
Well, I've seen something recently. I think it was on the internet where you can get kits to test for COVID at home. Are those accurate? Like, can people really, can you give us some insight on that?
And so for the antigen kits, we typically recommend that individuals only use those if they're symptomatic, because they're more accurate if you actually have symptoms. If you don't have symptoms, just getting screened, or you've been exposed to someone who tested positive for COVID-19, we really prefer the gold standard, which is the polymerase chain reaction test, or PCR test, which is you can do either get a nasal swab or a saliva test. So the PCR is what we recommend because it's more accurate.
Which one? Which one is that again?
So the nasal swab.
Okay.
Or they also have a saliva-based test that you can use as well.
And did you say that the nasal one was more accurate, or just the ones that you get?
Just the PCR test.
Okay.
Yeah, just the overall test.
Okay. Got it. I want to make sure I was hearing right.
Hey everybody, you know what time it is. It's time right now for our Pick the City Up art interlude, featuring an original piece by St. Louis story stitchers called Good for Your Health.
People, our people are dying from left to right. It needs to end now. We can't continue to live a life without resources. We're all sisters and brothers in the hands of the greatest. We must unite for this common cause, for each other's health. It all starts now.
Vegetables, tomatoes,
broccoli.
It's good for your health.
It's all good for your health, yeah.
It's good for your health.
It's all good for your health.
Eat your veggies, eat your greens, cause you gotta keep it clean. And some fruit, cause it's good for your health. Yeah,
Cause it's good for your health. Yeah.
It's good for your health.
Yeah.
I like carrots, I like broccoli, give me cabbage. Empty carbs, I can't handle, they do damage. I need balance, healthy habits. I'm gon' grasp it, got a salad, take a pic. Post to Snapchat, meal planning is my hashtag cardio. In the morning, fruit smoothie with the oranges. Y'all stay on it, but don't be sleeping on healthy eating. Time be creeping up on you and your body start reaping every seed that was sown. Good or bad, it will show. Red meats, cut them low, too many sweets. Gotta go, or your teeth gon' hit the flow. And to work gon' cost most. Just gotta let you know that the stuff that you eat can change your life, but you decide in the end just how it go. You won't regret it later on.
Vegetables, tomatoes, broccoli.
It's
good for your health.
It's all good for your health, yeah.
It's good for your health.
It's all good for your health.
Eat your veggies, eat your greens, cause you gotta keep it clean. And some fruit, cause it's good for your health. Yeah,
Cause it's good for your health. Yeah.
it's good for your health.
Yeah.
I eat veggies, I eat fruit, processed food, yeah, that's on mute. Cause I wanna live a long life, I got a lot of work to do. So I put them cookies down and I pick an apple up. Cause what you put down in your body will eventually show up. So I balance life with exercise and health, eat all good vibes. You only get what you put in, so best believe that I'm eating right. And you may think what's right is wrong, what's wrong is wrong, what's wrong is right. But eating healthy is always right.
But eating healthy is always right.
We got these food deserts placed in our hood. Don't gotta walk far to find what's cheap and good. But when I go to the store, I'm not falling for the trips. Put down the soda and candy and grab a water and drown it. It may seem lame, but at least I'm fit. 5 for 2, fruits and veggies, and I'm still lit. If we wanna beat the system and I live by genes, we gotta be conscious, become healthy.
System now.
Vegetables, tomatoes, broccoli.
It's
good for your health.
It's all good for your health, yeah.
It's good for your health.
It's all good for your health.
Eat your veggies, eat your greens, cause you gotta keep it clean. And some fruit, cause it's good for your health. Yeah,
Cause it's good for your health. It's all good for your health, yeah.
It's good for your health.
Yeah.
Eat some veggies, eat some greens, cause you gotta keep it clean. And some fruit, cause it's good for your health. Yeah, it's good for your health.
It's
Check it. Vegetables, tomatoes, broccoli. It's good for your health. It's good for your health.
Hey, how y'all doing? I'm KP. What would be your advice to any group or youth organization that's trying to convince, young African American, children to take these vaccinations that are over the age, 12? What would be your advice to them to be able to be a sound message that we could give them to kind of get rid of the dogma and the mass hysteria, if you will, that's being put around this whole COVID, subject?
So the key thing is making sure they have accurate information. What we are finding is that there's a lot of misinformation that's circulating in our community. And some of the information is being perpetuated by adults. So making sure that we are providing them with accurate information. The health department, we try to be available as best we can. There are also other medical providers in the St. Louis area that can be of assistance. And so we urge you to really reach out to the health department or your medical provider to ask ask them about any questions you have related to COVID-19, the COVID-19 vaccines. Because one thing that we don't want to continue to happen is for misinformation to lead to additional deaths in our community, because that's unnecessary loss, and everyone is impacted when someone dies.
So I have a question. Why can't we use patients that are in the hospital as a testimony to what's going on?
So there have been some efforts around that. So it's up to the patient, though, right? So we have the numbers. We know what the numbers show us. But it's really up to the patients to be willing to share their own story. One thing that we did find as we were holding vaccination clinics is that a lot of the people that were coming through were individuals who were previously infected with COVID-19. Some of them had been in the ICU on ventilators, and they just knew that they didn't want to go through that again. And so if they were able to get additional protection by getting the vaccine, that's what they felt was in the best interest for themselves and their families.
We use those patients to tell their stories more.
So that will be a collaboration with the hospital system. So we have to go through the hospitals. But then if you know family members who've been infected and they've had some challenges or complications, reach out to them directly. Oftentimes they'll be willing to share that information with you.
How you doing, doctor?
I'm doing
Howard
good.
Cox. Question, with hundreds of millions of vaccine doses in circulation, why has the vaccine yet to be approved by the FDA?
So oftentimes it's the need for additional data. So right now all the vaccine products, so the Pfizer vaccine, the Johnson & Johnson vaccine, and the Moderna vaccine, they've been approved under emergency use authorization. But the remaining steps is really for those particular products is just going through the federal process. And so we anticipate that those products will receive official authorization by the end of the year.
Okay. Also, there was some news going around that I've heard recently. I don't know if this is true or not. You can verify it for me. But that vaccinated people are less. It's more possible for vaccinated people to spread the virus than unvaccinated people. Is that true?
No, not that they're able to spread it.
Likely or more possible to be carriers.
So they can be carriers. And what we found, so we talked about this a little earlier. So recently there was an outbreak in Cape Cod, Massachusetts. And what they found was over 450 individuals developed COVID-19 disease after becoming infected with SARS-CoV-2, the virus. And over 70% of those individuals were fully vaccinated. So that means that even if you're fully vaccinated, you can spread the virus to others. And so that's why we still recommend individuals wearing face covering, socially distancing themselves, as well as practicing good hygiene, because those mitigation measures are really critical to help stop transmission.
Thank you.
Thank you. Thank you, everybody, for sharing those questions.
I got a question.
Go ahead.
So, do it really matter if if you get vaccinated, if you still can catch it?
So it does. So imagine if you were unvaccinated And so you have underlying medical conditions, or maybe you don't have any medical conditions, and you end up getting infected with the virus. So if you're unvaccinated, you're more likely to have severe complications that require hospitalization and death. So I think one thing we have to do as a medical community is rebrand how we rebrand the vaccines, essentially. So the messaging around vaccines initially was that the vaccines were going to be a silver bullet. The vaccines are not a silver bullet. Because individuals can still get infected with the virus. They can still spread it to others, even if they're fully vaccinated. But the advantage that vaccines give us is that we have additional protection. So in the event that I get exposed to someone who's COVID positive, the likelihood that I'll end up in the hospital, the likelihood that I'll end up on a ventilator or life support is significantly reduced. Okay. So the vaccines are meant to save lives, so prevent those severe complications. So in the event that you do get exposed and you are infected, the likelihood of having severe complications is really low.
Okay. Thank you. What are some things that we've done, if you know, in the past, like when influenza came around, it was a big deal. I bet it's probably similar to this. So how did we get here now, to where it's not like this huge deal? Was it the vaccine that helped with that, or was it like some other steps that we took as a community as a whole, to, I guess, lessen the stress and the number of deaths from the virus?
So there's a document that was done by I believe it's the CDC, and what they looked at was all-cause mortality going back to the early 1900s. And so we know that in 1918 that was what they call the Spanish flu, so that was a pandemic. Then we also had H1N1 in the not too far past, and what we found was that in both cases, in both of those situations, the same mitigation measures were implemented. So, with the exception of face covering, social distancing, we had to close businesses. There was a shutdown for the 1918 pandemic. For H1N1, it wasn't as severe, but it did impact the economy and it impacted aspects of government. But the same mitigation measures, so making sure that people practice good hygiene, make sure that people stay home if they're ill. Those same mitigation measures were really important then, and they're important now. But it's really up for us to continue to implement them. And because what we're learning now is that there are more viruses, there are more pathogens, not only in the United States, but across the world. And we never know when one of those pathogens may mutate and become and be able to spread between humans. And so that's what's happened with COVID-19. We never know what the next pathogen is going to be. And so by implementing these really critical measures now, we can help save lives moving forward.
Absolutely. If you could say anything to a youth who's maybe scared to get the vaccine, what would be the thing that you would say to that youth in order to either help educate them or encourage them to go with their first mind, or whatever that may be?
I would encourage them to go to someone that they trust to get accurate information. Ask that individual, whether it's their pediatrician, if there's their primary care doctor, if it's a public health professional. Go to someone that you trust and someone that you know is going to give you accurate information so you can make an informed decision. I say time and time again, the health department's primary responsibility is making sure that we empower our community by giving them accurate information. And that's really one of the most important roles of all medical providers, is to educate individuals who are under their care. When you go to your primary care doctor's office, your pediatrician's office, it's really important for you to ask the questions that you have when you're in that setting, so that you're well informed about your own health and you can advocate for your health beyond the walls of the medical provider's office, and you aren't tied to just relying on someone else to advocate for you.
Is there a website or somewhere people can go just in case they don't have a person they could reach out to? Is there like a website or something where they can go to get more facts about COVID or the vaccine.
And so the health department, so we have a vaccine page. And so individuals who want information about all 3 vaccine products, if they also are interested in knowing, seeing the impact of COVID-19 on communities across the city of St. Louis, they can go to our website, which is stlouis, it's stlouis-mo.gov. It's stlouis-mo.gov. And if they want to talk to someone, we also have staff who monitor our COVID-19 hotline. And the number for that hotline is area code 314-657-1499. Again, it's 314-657-1499.
Thank you. And then another question I have, could they find on the same website information for places to go get tested? And, if they want to get vaccinated, where to get vaccinated. I know a lot of people have a lot of questions about, especially when it comes to getting tested, they want to get tested right then and there. But it's a lot of places that require appointments or and then they take a few days.
Right.
Is there any way around that?
So we do have information on all of our upcoming vaccination clinics is posted on that site. So if you're looking for a place to get a COVID-19 vaccine safely, you can go to our website and look at our upcoming events. We're actually hosting an event tomorrow at the Enterprise Center. We'll be there from 10 a.m. until 2 p.m. Then we have several events related to associated with back to school events coming up over the next few weeks as well. For your other question
about the COVID testing.
So testing, there are several locations in the city where you can still get tested. You can go to Affinity Healthcare. They are offering testing. I believe other federally qualified health centers are offering testing as well. So you can go to Betty Per People's Health Centers, Affinity Healthcare, Family Care Health Centers, and Care STL Health Centers. So all the federally qualified health centers in the city of St. Louis can offer COVID-19 testing.
Is Walgreens, is that, because I heard some people got tested at Walgreens.
Or like a CVS?
I know at one point they were offering testing, but I know right now they're offering vaccinations. I'm not sure if they're still offering testing or not.
Okay.
I have a question for you all.
Yeah, I was just going to ask before we wrap up, I was going to ask if you had any questions or was there anything that we didn't touch on that you want to talk about?
So I just want to hear your perspective on the messaging related to COVID-19 vaccines. How did you first feel when you started hearing about the vaccine? And were you hesitant at first? And if you were, why? And that's for both of you.
Absolutely. Definitely hesitant because when COVID first happened, I was, everybody was watching really closely about the news and what was going on. And for me, I was hesitant because what initially was said is that we wouldn't have a vaccine for at least 18 months. And then we had one within half of that time. So that kind of made me wonder, is it safe?
What's going on?
Yeah. How safe is it? I wanted more data, more facts, more information, more results of, what does it do? And then, no, a lot of people, well, not a lot of people, but some people have allergic reactions or are allergic to some of the things that's in the vaccine, so they can't even get it. So, just still kind of doing research and keeping an open mind, I guess, was kind of what I was trying to go for. But definitely the one thing that really stumped me was we had it in half of the time that it was initially said, we're not going to have it until 18 months after. And then it was 9 months later, voila, magic is on the scene.
So at this point, do you understand why it was why they were able to get the vaccines out and get them approved over a shorter period of time?
Could you say that one more time for me?
Now, what's your understanding of why the vaccines were able to be produced and get approved over a shorter period of time?
Not 100%. I kind of understand it, but still not like 100%.
Like the process.
Yeah, still like a few like gray areas. I'm like, okay, as things unfold, and then you hear something like the Johnson & Johnson happening, then it makes you kind of like, all right, okay, let's get some more data, but yeah, not 100%.
So let's talk about that a little bit. Then I'll have you answer the question as well.
For myself, somebody like close to me had like allergic reaction to one of the vaccines, so they kind of put me on the borderline. Like, what happened? Like, that could be me. So I care about myself. I don't want to be like, so I'm still kind of half and half with it. Like, I'm still kind of building my own, like opinion of the data, with the data and stuff. So I can just make my final decision for myself. But, so I'm like looking at the facts, putting in consideration, like, okay, I got a family, I don't want to affect my daughter or so on and so forth with other family members. So I do want to kind of like put everything in consideration, like outside of myself when making my decision though.
Right. So when we talk about the vaccine and the process for developing vaccines, so there was a lot of concerns about there being shortcuts. There were no shortcuts taken. So when you have a pandemic, it's really an atypical situation. And it's not normal by any means. And so not only do we have millions and millions of cases of COVID-19, there was also billions and billions of dollars that were going into research and going into manufacturing so that when the product was approved, it could be made readily available or shipped out as quickly as possible. And so having millions and millions of cases of COVID-19 gave them an opportunity, the pharmaceutical industry as well as the CDC and other public health organizations, the opportunity to conduct clinical trials over a shorter period of time. And so they still went through phase 1. So there's typically three phases of clinical trials. So you have phase 1, phase 2, and phase 3. All those phases were still completed, but when you have millions of cases, you're able to evaluate the efficacy or the effectiveness and the safety of a product over a shorter period of time. So all of the vaccines that were tested that are currently available, the Pfizer vaccine, the Moderna vaccine, and the Johnson & Johnson vaccine, they had clinical trials that included over 30,000 individuals. So it wasn't like they just took 10,000 people or a handful of people and said the product was safe. There were over 30,000 people that participated in the clinical trials, and that data, the data that was collected on the safety and effectiveness of each vaccine product, was heavily scrutinized by not only the CDC, but the NIH. Then there's an independent group called the American Advisory Committee on Immunization Practices. These are subject matter experts from across the nation that come together. They don't have any really major conflicts of interest related to the vaccine development. And so they come in to provide their expert opinion on whether or not the vaccines are safe and effective. And so they look at the data heavily before they give their recommendation to the FDA. And they're constantly engaged. So whenever there's a new recommendation that's put forth by whether it's the FDA or the CDC, this group comes together to meet to discuss the data to make sure that we aren't causing additional harm to the community across the world, across the nation. And so lots of checkpoints are in place. And then, as we talked about before, the VSafe application is a tool that's used so that we can continue to monitor the side effect profiles and the safety of these vaccine products that have been approved.
I had a question. Okay, yeah, so thank you for that. And then you said 30,000. So is that 30,000 for each vaccine?
For each vaccine.
Okay, and then also, have they had any tests to see I'm guessing they would, to see I guess which one works better?
So that's the safety and efficacy, or the safety and effectiveness profile. So overall, each vaccine product has been determined to be safe. The effectiveness does vary. So for the Moderna and Pfizer vaccine, for the first dose, the effectiveness is roughly 80 to 85%. Then when you get the second dose, which we call the booster dose, that ramps it up to about 95% for both the Moderna and the Pfizer product. For the Johnson & Johnson vaccine, the effectiveness is around 80% just for one dose. And so all are effective. And then I think one of the questions you asked earlier was around the effectiveness of the as it relates to the variants that have been detected. And they have been proven to be effective against preventing severe complications even when someone is affected with the variant.
Okay.
But it's important though. So that's based on the variants that we have available now, that we know about now. So if additional variants are developed over time, they may be more resistant than the current variants. So that means that the vaccines that are currently available may be less effective. That's why our focus has to be stopping the spread or stopping transmission of the virus. Otherwise, we'll be variant chasing for decades.
Yeah. So is that another reason why isn't it, well, let me make sure it's true. Is it true that the influenza vaccine, does it change? Or is there different ones? And is that a reason why too? Because there is probably more variants. It's probably way different now than it did back when it first started.
Right. Yep. Just similar to the coronaviruses. So the influenza virus also has different variants. So if you look at each season, the CDC selects, for each season, the CDC and NIH select the top 3 or top 4 variants that are circulating across the world. And those are what they include, bits and pieces of the DNA of those variants are what they include in the flu vaccine each season. So if you look at, some people get, it's one that has 3 components to it, and there are some that have 4 components to it. But they all include different strains of the flu virus.
Okay. And then something else I want to touch on too really quickly is a lot of, especially in the African American community, a lot of people have a lot of pushback because of previous problems with, healthcare and, being given the wrong medications or drugs, or, how do we try to get through that? How do we try to, because I think that's a really big thing, especially for the African American community. And I think that's probably one of the top drivers for a lot of people not wanting to get it, because they feel like they can't trust or they don't know who to trust, and then there's all this information out there. So they're probably like overwhelmed, right. So how do we kind of chop down some of those walls?
So the first step is really acknowledging that we've caused harm to African American communities. Whether it's the Tuskegee Project, it was the Henrietta Lacks situation, or even more recent situations where minority populations have been exploited due to medical research, or even just been being treated badly when they go to receive medical services at either hospital system or other medical center. We have to acknowledge that. We have to own that we've caused harm to the community. We also have to own that there's been significant levels of disinvestment that have occurred in predominantly minority communities. So we can't just gloss over that and expect people to get over that just because we're in the course of the pandemic, because those are lived experiences that we have to honor. And we fail to honor it now. Our ability to gain trust within those communities will be significantly challenged moving forward. And so the City of St. Louis Department of Health, I can't speak about other health departments, but the City of St. Louis Department of Health is really adamant about making sure we honor individuals' lived experiences and that we don't gloss over the damage that has been done over time. So that's the first step. Then the other step is that we have to look at the system and figure out what needs to change in the system. So is it that our medical providers need to be better trained in providing culturally and linguistically appropriate services? So there are federal standards that hospital systems and federally qualified health centers have to adhere to because they've received federal dollars. And those 15 tenets, I can't go through them all right now, but there are 15 tenets that they have to comply with. And if individuals are not, the individuals don't receive the appropriate care, there are grievance processes that they can follow to make sure that the hospital systems, as well as the federally qualified health centers, are held accountable for what they're doing.
Yeah.
But a lot of individuals in our community aren't aware of that. So the second step is that we really have to teach individuals in our community how to advocate for themselves. How to teach them, that it's okay to ask questions when you go to the medical provider's office. It's okay to have a list if you need a list. And it's okay to say that, hey, I'm not comfortable with that right now. Let me look and either get a second opinion or let me go do some research and then come back. We really have to make sure that our community feels empowered to advocate for themselves. Otherwise, the damage that the system has done and continues to do will just continue over time.
Yeah, absolutely.
And that's how we build trust. But we also have to make sure as an agency that we're going out into the communities, we're being present, we're providing them with resources, good resources, and providing follow through. That's really important. As the community sees us more, the more they'll trust us and know that our engagement is genuine. Because oftentimes what you'll see, and I've seen this as well, is we'll go into communities because we need something, whether it's information for research, we need clinical specimens, we're trying to obtain a better understanding of how minority populations live, but then we leave them after we get that information.
Yeah.
They deserve better than that, right? So we need to make sure that there's a communication loop so individuals who participate in whether it's medical research, public health research, make sure they understand how they're contributing to the advancement of public health, how they're contributing to the advancement of medicine, rather than just leaving them high and dry after we collect their information.
Yeah, that's great.
And that's where you all play an important role, right? Because you all are up and coming, and we need to empower you also that as adults, you'll know how to navigate the system, you know how to challenge the system, and you know how to advocate for yourselves and your families.
Exactly. Yep.
What does that mean for you when you hear the term advocacy, particularly as it relates to health, and you thinking about your own health? What does that mean for you at where you are right now?
Can you say that word again? It was
advocacy.
Okay, got it. You want me to go first?
I can go.
No, you go ahead. No, you go ahead.
To me, it's basically I kind of interpret it as like take control of my own health. That's kind of like the overview, like what I, like understand of the word. Just like my overall, basically my own empowerment of my, my decision for my health outside of the medical profession.
I kind of piggyback that, but to add more to it, advocating even for my own self, I think probably encourages other people to do the same, or gives them an example of what it kind of looks like. Because, some people more than we probably think grew up in very passive homes, so maybe they don't feel like their opinion is valued. And that's why I like Story Stitchers too, giving you a platform to let their voices be heard. So really just kind of advocating for myself and, encouraging youth to speak up, like how does this make you feel? Because some youth aren't used to reflecting, and really getting down into why they feel a certain way when somebody says, they haven't gotten into those triggers or even trying to figure out what triggers are, and sometimes like conversations like these can trigger them and they just shut down,
Make the brain think different.
Like they just shut down, they just leave, and they're uncomfortable and they don't know how to address it. So advocating for me kind of goes deeper you know, even when it's me advocating for myself, you know, maybe I feel one way about something, but somebody feels another way, you know, and hearing me talk about it is empowering them to stand up and giving them courage to say what it is they feel they need to say.
When I think of it, I think that we advocate for things that we see value in. And so when we talk about advocacy, particularly for minority populations and just youth and individuals that are coming up, we need them to understand that their life is worth fighting for.
Yeah.
So their actions will impact future generations. And so we can teach, or at least empower you all to advocate for yourselves at this point in time. You can influence your colleagues, your peers. And then when you get to a point where you have families, you can teach your children, your children's children, how to advocate for themselves because their life is worth fighting for.
Yeah. Absolutely. I think that's a big thing too, you know.
Real inspirational.
Yeah. It's sad too though, but there's a lot of youth actually that I've had a few podcasts like that where they didn't feel that their life was valuable enough to think about life past the age of 18. Mm-hmm. It was always, if I make it there, you know, so I think advocacy is a very big thing, and just giving youth really an outlet to even express, you know, themselves, whether it's creatively or just really just talking it out on a podcast, I think is very important.
Absolutely.
And especially with a professional like you, to coming back up and give us facts about, you know, some of these things that we may be feeling or thinking. So again, thank you.
My pleasure, absolutely.
Yeah.
As we look, as the health department, we look at the impact that all of this investment has occurred. And when you strip resources away from a community, that leaves them hopeless. And so that feeling of hopelessness can leave individuals feeling, hey, the government doesn't care about me. Maybe I shouldn't care about myself. But changing that paradigm and really not only teaching individuals how to fight for themselves, but also how to thrive is really important. So how to live a healthy life, how to have a balanced diet, how to prioritize relationships, how to have healthy relationships. All these things that we talk about are really important, but we need to make sure that, again, one, we're present in the community so that they trust the information that we're providing to them, but then also making sure we're following through with them, we establish those relationships so that they can really truly implement the thing that they need to do to live a healthy life.
Absolutely. Did you have any more questions?
No, you pretty much answered all my questions.
Well, I have another question.
Okay.
So as we've gone through the pandemic and we've seen that African American populations have been disproportionately affected. So, for example, in the city of St. Louis right now, African Americans are accounting for roughly 80% of all the COVID-19 cases that are being reported. How does that make you feel? And if you could do anything right now to change that, what would you do?
Delete COVID.
Well, yeah, that how it makes me feel, definitely I guess how I've kind of always felt, you know, that we need more support, more care, more community, you know, and how to stop that. I don't know. I think there could be a lot of ways. I think my biggest thing would be money, like the flow of money, whether that's like jobs or, because I think anything we say that we need is gonna
need funding.
Take funding.
Some way or some form.
Yeah, you know.
Some money's coming out of somebody's pockets.
So yeah, that's just to kind of sum it up really quick.
I want to piggyback off what you said. Like money, just on the fact that everything needs funding, and social media, just on the fact that it's a big influential thing right now. And I think social media plays a major role in a lot of youth coming up, since a lot of youth be on their phone from babies to, you know what I'm saying, our age to even older. So I think social media is really the big main factor that will help all of COVID in a sense.
Any particular platform, social media platform?
Yeah, I think pretty much all of them is pretty much equally, influential.
Especially if Facebook owns it. Facebook or Google.
Okay.
TikTok is really popping right now.
Yeah, I say TikTok for the youth. For sure.
What about the babies? Because you said babies are using social media.
Like my daughter be on YouTube, YouTube a lot. So it's kind of like I say YouTube is a major role also. If it had some children shows that teach about COVID at a young age, I think that'd be a big help because it'll train their mind and their mindset at a young age to help them grow. It'll grow with them.
I have a question.
Yeah, so I was gonna ask, so the kids who are able to get the vaccine, would you encourage them to get it?
Yeah, so most of the children have to go with their adults. So our primary goal is making sure the adults have accurate information because they're the true advocates for children. And so if adults have accurate information, they can make the right decision for themselves and in their household, which includes their children.
Thank you.
So part 4?
Right.
I enjoyed talking to him.
Yeah, that's
I want to see him come back.
Did you have anything else before we close up?
I'm just grateful for the opportunity. I'm hanging out with cool youth on Friday. Like this is what's up.
Absolutely. Any more questions from the audience? Anybody?
It's the best time to get it off your chest.
Nobody? Okay. Oh.
I mean, some people be shy.
Okay, cool. Well, Doctor.
But more people coming for the dance battle. If there are no people coming for the dance battle, I'll be the only contestant so I can get my prize money.
Absolutely. But thank you again for coming. We really appreciate it.
Thanks.
Thank you, Lucas, for co-hosting.
My pleasure.
Thank you, everybody, for listening. We hope you got a lot of good information from this podcast. Feel free to rewind it, play it, download it, share it. And until next time, and we out.
Thank you for listening. And last but not least, we want to give a very special shout out to the StitchCast Studio sponsors. StitchCast Studio Season 2 in 2021 is sponsored by the Spirit of St. Louis Women's Fund 3-year grant from 2020 to 2022, Arts and Education Council PNC grant, and Lush Corporation's The Charity Pot. Peace in the Prairie is presented with support from Missouri Arts Council, a state agency which receives support from the state of Missouri and the National Endowment for Arts. Additional support is provided by the Spirit of St. Louis Women's Fund, Missouri Foundation for Health, City of St. Louis Youth at Risk Crime Prevention Grant of 2020, Stewart Family Foundation, and Kranzberg Arts Foundation.
They say who that, but you already knew that. That be them story stitches.